Buprenorphine is an FDA-approved medication that helps people with opioid use disorders by reducing cravings and the symptoms of withdrawal. Buprenorphine therapy is an evidence-based practice that increases a person's ability to participate fully in a comprehensive substance use disorder treatment program. Lynn Madden directs the APT Foundation in New Haven, Connecticut, which offers medication-assisted treatment for opioid use disorders with all of the currently FDA-approved medications. In this video, Dr. Madden shares insights on the financial aspects of providing medication-assisted treatment.
I think there is some difficulty in various parts of the country in figuring out how to pay for the use of buprenorphine. There are some states in the United States in which the Medicaid program has added buprenorphine in one version or another to its formulary. And in those states, it's much easier to sort out how to help a person pay for his or her medication than it is in the states where Medicaid is not yet a payer for the use of buprenorphine. That being said, I do think it's important to understand that healthcare providers have a role in advocating for the provision of evidence-based treatments. The best treatments that we have for the treatment of opioid use disorders are medications. And so in those states where there is not yet widespread payment options for the medication that may be approved by the FDA for the treatment of this disorder, I think part of the answer to this is advocacy. The other answer for me is always that we struggle with the provision of medications for many people who have chronic illnesses. And one example of that might be diabetes. Right? You have to use medication, many people, for the treatment of diabetes. You have to use insulin or other medications. And healthcare insurance plans are not uniform in how they pay for particular medications. So I would say providers are already experienced in many ways at figuring out how to get help for the patient who they are trying to treat. So various manufacturers or pharmaceutical companies have programs for people where you can get discounts. There might be a program at the local or county government level that's helping to provide resources for the provision of a particular medication, such as buprenorphine. And so the landscape is, I think, is a little bit complicated, but it's not really different than the landscape that we have navigated for the use of medications for other chronic illnesses. I think there are two ways of really looking at this. One way is that the medication itself is prescribed on an outpatient basis. So the organization doesn't actually pay, generally speaking, for the medication. It's the patient who has to pay for that, or the patient's insurance company. So what the organization has to sort out is how to be efficient and effective in the provision of the care that it provides, the prescriber time, the clinical counseling time, perhaps the case management time. I would suggest that many organizations do this already, and that it's not very different than how to figure out, how to make a primary care practice work from a financial perspective. It's really about community partnerships. It's about understanding what efficiency and effectiveness really looks like. I can tell you from experience that the patients don't take up more time than any other person that might be in a family practice or internal medicine setting who has a chronic illness. So on the organizational side, unless you're providing the medication, the most important thing is to understand how to integrate this type of treatment into your existing practice. Understand that our physician recruiting bundle can help you with that. We have some information about that on our website at niatex.net. And understand, in many ways, you already know how to do this, right? You're already treating people with chronic illnesses. This is not a lot different. That, again, I would separate that statement a bit from if you have to sort out how to provide enough resources to actually pay for buprenorphine or another medication as an organization. You really need to understand what the insurance landscape looks like, what the grant landscape looks like in your community, and what the where the dollars are flowing from the government or other funding sources into your community. And it really does look different everywhere across the country. To the belief that medication-assisted treatments, particularly buprenorphine in this conversation, are too expensive to provide, I would first start by understanding that the provision of these medications is not inexpensive, but it's far less expensive than untreated chronic illness. This is very similar to the use of medications for people with diabetes. So people who are taking a medication for for an opioid use disorder, if they're taking the right medication at the right dose, they tend to stop using the emergency department. They don't end up as inpatients for other reasons that are connected to the opioid use disorders. They don't overdose. So although the medication itself may seem expensive on the face of things, from a public health perspective, it is far more effective for that person and for the community at large to provide the medication than not to provide the medication. So that's a kind of wider community or public health frame or way of looking at the provision of these medications. From a personal or family perspective, how do we pay for this medication? I think the answer is that paying for the medication is important to the extent that it's the only effective way we know of to treat these illnesses. So in the long term, investing in these medications is far better for the health of the person, both in real time and in the future, and for decreasing medical costs to that individual and to that family in real time and also into the future. I do think that similar to many medications for the use of treatment of chronic illnesses, there are many ways to get the medication paid for. One can advocate to an insurance company. Many insurance companies now pay for these medications. One can advocate to have a reduced cost medication from the pharmaceutical company itself. Many pharmaceutical companies provide vouchers for the use of buprenorphine, similar to the way that they provide vouchers for other medications that are for people who have chronic illnesses and who can't afford the medication itself. One of the things that any organization can do to get started with an MAT program is to educate itself. Right? First and foremost, understand the evidence base, understand the need in your own community. These are really important factors that help organizations decide if they're going to pursue a kind of treatment, whether or not they entirely understand how to pay for it. Right? So that's first and foremost, that's critical. Information is always critical. Secondly, I think it's important to model from a financial point of view what you think your program is going to look like. And by doing so, you might understand how to create some efficiencies or how it's similar or dissimilar from other programs that you're already providing. The most efficient and effective way for an organization to introduce MAT is to introduce it into existing substance abuse treatment programs or into existing multi-specialty practices such as a primary care setting or an internal medicine setting. You will find when you do some financial modeling that you are already doing for other patients most of what you will do for these persons as well. Ultimately, as you stick your toes in the water, perhaps by pilot testing, adding 5 or 6 patients who need this kind of treatment to your practice and beginning to understand what it really takes to care for them, I think that you will ultimately find that it's not very different than caring for other people who have chronic illnesses, which most providers are already very good at. So part of this is about understanding your own landscape in terms of payment. How do dollars really come through the door? What do you need to bill in order to adequately care for the patient? What is your reimbursement for that code that you would bill for? And our NIATEX toolkit can help you begin to sort through some of those things. I would also refer people to the NIATEX billing guide, which can be found on niatex.net. There's a very nice diagram that outlines the steps that one has to take in order to successfully bill and chart a particular kind of care provided to a patient. And so for organizations that are not currently billing, it can be a nice way of getting started. And again, I highly recommend pilot testing. It's much better to learn from your own data than to necessarily plan something in a wide scale without knowing whether it's going to work for your organization or not.
Watch the other videos in the series, which cover the physician's perspective, concerns about diversion, securing buy-in, and recruiting prescribers.